Pain is one of the most common reasons Americans go to the doctor. Each year, hundreds of thousands of patients turn to spinal fusion surgery.
But that procedure has sparked debate in the medical community over whether some doctors are performing the spinal fusions that are unnecessary and even dangerous. Mark Strausman is here with the CBS This Morning investigation. Mark, good morning.
Good morning. We started by exclusively obtaining part of a government database. We asked for the number of spinal fusions each doctor billed to Medicare from 2011 to 2012 under codes most commonly used for degenerative conditions that cause low back pain. The data led us to Dr. David McCord in Nashville, Tennessee. He performed these procedures on a higher percentage of his patients than almost anyone in the country. CBS News has also learned that his practice has repeatedly come under scrutiny. One hospital even banned him from operating there. It found he had performed unnecessary surgeries that put patients at risk. Barbara Jo Smith has lived in Clarksville, Tennessee her whole life. She grew up on a farm, riding horses and chasing around two brothers. But by age 45, she had developed debilitating back pain.
I couldn't pick up the kids anymore, or I'm a house cleaner, and I couldn't do what I used to do.
She went to a chiropractor and tried physical therapy. When her pain got worse, in May of 2010, she saw Dr. David McCord in Nashville.
And sometimes there's another answer. There is hope.
His website calls him a pioneer in the treatment of spine pain. Dr. McCord performed a spinal fusion surgery on Smith, using metal plates and screws to join 3 of her vertebrae.
The worst thing could happen, I thought, was it just wouldn't fix me. I didn't know it was going to be worse.
How worse?
It hurts to sit. It hurts to stand. It hurts to lay. It hurts to do anything. There's mornings that I have to sit and talk myself into getting my socks and shoes on for like 15 minutes just to get them on.
From 2001 to 2011, the number of spinal fusions in the United States increased 70%. There are now about 490,000 of them performed in the U.S. each year. Experts say part of the growth has to do with improved technology and an aging population demanding greater mobility. But there are also concerns that some doctors may be performing spinal fusions unnecessarily.
I've been involved in studying this problem for...
Dr. Sohail Mirza is chair of orthopedics at Dartmouth-Hitchcock Medical Center. He has published studies on what he considers the over-treatment of back pain. When it comes to individual cases, doctors can disagree about whether a spinal fusion is appropriate. But Dr. Mirza says he generally recommends against it when treating the diagnosis that Smith was given.
If I'm a back pain patient and I walk into a surgeon's office and he says, have a spinal fusion, what is it that I, as the patient, need to know?
The benefit is limited and it's short-lived. After a year, certainly after 2 years, if you were to avoid surgery and have surgery, the results in terms of pain improvement are not very different.
Dr. McCord's surgical judgment repeatedly came into question at Centennial Medical Center in Nashville. In the late 1990s, the hospital conducted a review of his practice. As a result, he agreed to limit his number of surgeries and get second opinions before operating. Then in 2012, the hospital opened a separate review of his hardware removal procedures. According to this confidential report, it found Dr. McCord had a pattern of performing spine surgeries on patients for whom surgery is not indicated. He was banned from Centennial and now operates at another hospital just blocks away.
Well, consider coming to see me.
After the ban, Dr. McCord sued Centennial, claiming that another surgeon used a sham review process to oust him because he was competition. The case was dismissed, and Dr. McCord's attorney says he will appeal.
Hey, buddy.
Dr. McCord invited us to his office, but would not give us an on-camera interview. He introduced us to 3 patients who all said he had dramatically improved their lives.
I work 60 hours a week, every week, and I could not have done that if it weren't for David McCord.
His attorney added that Dr. McCord has never settled or lost a malpractice lawsuit. In a statement he wrote, "We will not verify many of these misstatements and ill-founded allegations. Of the hundreds of patients Dr. McCord has treated, the vast majority of them are much improved." But concerns about this procedure go beyond Dr. McCord.
When we looked into the surgeons that perform the most spinal fusions in the Medicare data, we found some were suspended by hospitals or settled lawsuits alleging inappropriate procedures.
Why are all of these spinal fusions being done, in your view, when they are inappropriate?
I have to believe that the surgeons think they're doing good. Every surgeon, I think, believes they're better than their peers.
Well, let me ask you about another potential factor. This is about the money factor.
It's a confounding issue. Surgeons get paid for doing surgery.
A doctor can make thousands of dollars from a single fusion. The procedure has helped make spine surgeons some of America's highest paid physicians. Their average salary is more than $700,000 a year. 5 months after Barbara Jo Smith's original surgery, she says her pain had worsened. So she went back to Dr. McCord, and he performed another spinal fusion.
And?
Didn't work.
Feel any better at all?
Oh, no. Mm-mm.
You feel as though all of this could have been avoided?
Oh, yeah. Yeah. And I try all the time to not think about this because if I could go back and not do it, oh, I wouldn't do it.
As part of our investigation, we put the Medicare data we obtained on our website, cbsthismorning.com. You can see how many of these fusions your doctor performed and compare them to others in the region. We've also looked into 3 more surgeons across the country and shared one top doctor's reaction to our findings.
So, Mark, this is really interesting. So does the data show if any of these spinal fusions were unnecessary?
It doesn't show either way. But Dr. Mirza says if your surgeon is performing a lot more fusions than their peers, you may want to ask them why and get another opinion. We should also mention that just one of these procedures can cost well over $50,000, including hospital fees. And so for Medicare patients, we taxpayers are footing that bill.
All right, Mark, thank you very much.